Welcome back to Ask the Educator, a podcast for all professionals involved in medical device processing and sponsored by Healthmark Industries. The education team here at Healthmark has 280 years of combined experience in areas ranging from sterile processing, endoscopy, OR, biomed, to hospital and industry leadership. Our goal is to leverage our collective experience to answer one of your questions each episode, giving you the practical tips you need to succeed in the evolving world of device processing. My name is Kevin Anderson, clinical educator here at Healthmark, and I will be your host. Let's get started. All right, welcome everyone to our podcast, Ask the Educator. We are taking a break from our normal podcast where we were doing a series on the 10 factors of cleaning with Stephen Kovac. I'm fortunate to be joined by Dr. Keith Kaye and Dr. William Roberts from Michigan Medicine. Thank you both and welcome to the show.
Hi, Kevin. Thanks so much for having me.
Yeah, happy to be here.
Thank you. We reached out to you because there was a piece from Michigan Medicine Headlines that highlighted the process your team took to safely process N95 masks for the battle against COVID-19. And going back, I remember emergency FDA clearance being given to process N95 masks and low-temp sterilizers, mostly consisting of vaporized hydrogen peroxide. And I think all of us in the device processing industry were happy to see that come through, but also concerned at the same time for potential safety hazards and the lack of sufficient testing. That's where this story out of Michigan Medicine really caught our attention. So I want to thank you again for your willingness to share here on the podcast a little bit about your story. So getting right into it, our first question, at the time you were developing your approach, there were so much uncertainty and confusion with multiple reported options for mask reuse and disinfection. Can you sort of just walk us through what that time was like and how you came to the decision to use the methods you ended up with?
Yeah, so in mid to end of March, it was becoming clear that the N95 mask supply was very thin and being stretched in this country. And observing what was going on in Italy and other places around the world, and even in New York, there was quite a bit of concern that we would run out of N95 masks. And so one approach to stretch their use and maintain the supply longer was to try and reuse, to disinfect and reuse these masks. And there were a number of institutions and places that were doing this, attempting to do this. And there was a lot of controversy and mixed messaging, both from N95 manufacturers about how it's not appropriate to reuse these, and from other groups and sites saying it is possible to do this. And so at Michigan Medicine, the leadership, what was set up as the hospital command center, determined that there in fact was a shortage of N95 masks, and we needed to try and reprocess and reuse those if it was safe. And so we were tasked with looking at the various options to pursue this and then testing those, not just counting on outside information, but actually testing it in-house, the process we set up to ensure it was safe. And really, the framework was that there are three things that were important in reusing these masks. One is that the processing technique, disinfection technique, needed to kill the pathogens and render the masks clean. Secondly, the process needed to be such that the filtration efficiency of the mask was maintained. So N95 masks will filter out 95% of particles that are 100 nanometers in size. And so we needed to make sure that that did not deteriorate as these masks were reprocessed. And thirdly, fit testing. So one of the very important things about an N95 mask is that it forms a seal to the wearer's face and maintains only air coming in is coming through the mask. And so fit testing ensures that that seal is maintained as well through the processing. And so we did examine a variety of different techniques: hydrogen peroxide, ethylene oxide, moist heat, ultraviolet radiation, ozone, a whole variety of other approaches. And part of the issue was we needed to have the ability to perform these different modalities in-house. And secondly, then we needed to test them as well. And so at the time, it was really an approach of starting with ultraviolet radiation and heat, as those were two that were fairly easy to set up, but we also explored ethylene oxide and the various instrument sterilizers with hydrogen peroxide. And this process in total took us almost 2 months to finally finish the confirmatory testing. But we were able to begin reprocessing after only about 1 month or so.
That's excellent. Dr. Kaye, did you have anything to add?
Now, Will gave a really thorough review. I'll just add that, just to remind people, as Will was sort of alluding to, is that these N95 masks are single use. So there really was almost zero data on reprocessing these. And when there was some data, there were single studies with small numbers, with very specific viruses or bacteria, with the methods not necessarily clearly laid out. So a lot of credit goes to our institution and our leadership, because when CDC and FDA guidance became available, I think there was an inclination just to jump on and say, oh, great, we have guidelines. We can use them. We don't have to think anymore. Now we can UV light's great. And I think a lot of credit to our leadership that they really relied on content expertise here, which, as Will was sort of our translational person that branched out to engineering. He involved me from an infectious disease and infection control perspective. We also had the actual reprocessing. So it took a multidisciplinary group. And when we looked at the data, we said, we don't really know that. We're not convinced that the data is there that makes us feel safe to put our providers on the front line, and we can vouch for these reprocessing techniques. We didn't feel that the data was high enough level, and so, as Will was describing, we launched into it a lot of support from our institution, the hospital as well as the university. We really launched into our own lab and our own testing of pretty much every possible reprocessing method. So, they always say a crisis can equal opportunity. And I think this crisis brought together a very diverse group of scientists and healthcare workers who made a lot of progress and really improved an evidence base around this N95 reprocessing in a very short period of time.
Yeah, that's exactly what I was trying to allude to in the intro, was just the lack of the data behind everything that was sort of coming out. So the work your team did is absolutely phenomenal. So sort of just getting more into it, there was more significant media attention given to the disinfecting or sterilization of N95 masks. And we all know from education and experience that something has to be clean first before it can be effectively disinfected or sterilized. So can you describe how you address this need for the cleaning, and maybe talk a little bit about that moist heat via converted instrument washers that we read about?
Yeah, so there really were two components that I think are very important to note about the cleanliness of the masks. I mean, you're absolutely right. Even with sterilization, in a high temperature gas sterilization, if there are biofilms present or encrusted material that's protecting microenvironments, sterilization doesn't work. So you're absolutely right that you got to clean. The trick is that these masks, it isn't like you can just throw them in the washing machine because they're not made to get soaked, or they can get a little damp, but they really can't get very wet. So I think one of the major components was visual inspection of the masks. And visual inspection was done somewhat on the floor, but also by our reprocessing personnel when they actually viewed the masks. They looked for tears. We had a lot of makeup and lipstick issues, which we then kind of passed the word up that if possible, try to limit the makeup and lipstick when you're wearing these N95s all day. But, when there was visible things that we felt we couldn't safely clean, or if the masks had gotten very wet, they were disposed, and we did not even attempt to reprocess those. I think the other important component was the use of face shields. Initially, it was using surgical masks or procedure masks on top of the N95 in an attempt, while they were using them in a single day before reprocessing, trying to limit the wear and tear and limit the dirt, really, and the soiling of the N95 itself. And I think the face shields became very rapidly, I think, a preferred method for people who had to wear N95s for multiple patients or for throughout a long period of time. The face shield really helped keep the N95s visibly clean and dry. So I think those are very two important components. And one thing we didn't want to do was try to reprocess N95s that were not reprocessable or weren't safe because of wear and tear or being dirty.
Yeah. And Dr. Roberts, do you have anything to add at this point?
No, I think Keith covered it very well. The sort of the guidance and the recommendations that were put out were evolving during this whole time. And so the implementation of face shields came on, as Dr. Kaye alluded to, and it was pretty dynamic. But I think the principles were there that we want to keep the N95s as clean as possible and discard those that were questionable or unsafe. I mean, the whole goal was really to maintain the safety of masks and keep all of the workers at our institution safe.
Excellent. Thank you. And I can really appreciate the inspection point. That's something that we as a company, we promote that heavily in the sterile processing, and even for endoscope reprocessing. It's a big, big part of the job of those processing techs and very, very important. So another question about the mask. So how did you establish how many times a mask could be reprocessed?
Yeah, so it's important that the mask continue to function as it was originally designed. So there's two components to that. One is how well does it filter particles from the air? And as you reprocess, there's a risk that material, that barrier, will become damaged and allow through more particles over time. And so it was important to test that. And so in conjunction with colleagues in the College of Engineering, in aeronautical engineering and civil engineering, who are familiar with aerosols and filtration, we set up apparatus in their lab so that a mask could be tested to determine, does it meet the N95 criteria? Does it filter 95% of the particles it's supposed to? And then we would reprocess these masks multiple times through the cycles and retest their filtration and ensure that it was maintained. And so many of the masks were tested 10 or 15 times, some only 5 with various techniques that we were reprocessing them with. But we ensured that filtration was maintained at that N95 level throughout, and ultimately set a limit of 5 cycles, probably more because of material degradation of the bands, the elastic bands, than the filtration itself. And then the other component that's just as important to maintain is fitting. Does it still fit the user and create a seal? And if masks are reprocessed, particularly in high heat, they can become more brittle, and that seal can be harder to ensure is in place. So the same process. Masks were fit to an individual, and then they're run through the cycle multiple times, and then refit to that individual to ensure that they pass fit test. So the 5 reprocessings was established for all of the modalities we ultimately endorsed using in all of the different mask types.
Excellent. And then Dr. Kaye, did you have anything to add as well?
No, Will just reminded me that one of the unique aspects of our reprocessing was that we designed the process so that the same mask went back to the same user. Some other third-party companies who've been reprocessing and just sending any old mask back to any old person, there's issues that the fit isn't right. And you can imagine that when you start wearing the same mask 2 or 3 or 4 different episodes, it gets molded to your face, right? I mean, you're pushing, you're placing it on your face and sort of molding it around your nose. So it was very important, as Will was saying, we determined that the fit was not disrupted, but not only that we made sure that mask, the individual person A's mask, was coming back to person A. So that just was another issue.
That's an interesting point, because we've done a couple talks with different people that have been in this space and dealing with this same issue. And we've actually seen that there was some variation, and some were just kind of reprocessing them and putting them out there for reuse by anybody. And then there were others that were tracing them for very specific users. So that was interesting that you brought that up. And I'm glad you spoke to that, because I always wonder about that myself as a former nurse, and having to go through that fit test and knowing that they're very everybody's face is different, and they're very specific for your face. You're supposed to carry around your mask. So that's kind of ingrained in me, but I appreciate you speaking to that. So what about a little bit more about the team of people involved in the decision making, and especially like the sterile processing staff involvement? What about that can you share?
Well, it was really an amazing convergence of people supporting the idea that we need to reprocess. And it was a clear decision made by the command center that we needed to investigate reprocessing and determine if it was safe and feasible to do to ensure the mass supply. And it involved, as we mentioned earlier, content expertise in every area. We weren't just reprocessing, but we were then testing on multiple aspects to make sure that the masks were holding up and were working as well after the reprocessing. So it involved Dr. Kaye and his group, infection control, infectious diseases, for content expertise there, civil engineering, aeronautical engineering, aerosol experts, and the engineering school. It involved the environmental services, who also are familiar with some of the modalities we tested. And then it involved sterile processing. So these are the people in the hospital that process instruments for the operating room and sterilize them and clean them. And much of the work that was done in disinfection and reprocessing was done in sterile processing, because that's where many of these machines were. And these were the people who are handling the masks and putting them through the process and then retrieving them at the end when they were disinfected. And along with that, in any large institution, it requires a fairly large chain of logistics to move the masks around. And then education of all of the nurses and doctors wearing these, nurses and other staff in the hospital, on how to properly wear them, take them off, place them in the bag, get them into the reprocessing cycle, how to retrieve them, and then the people who move those back and forth. So it was a very complex, multi-layered operation to set in motion. And the decision making not only started with safety of the individuals wearing the mask, but also ended there. And along the way, it involved all these other groups to ensure that masks were safe and that the testing was complete and everyone had confidence in this process.
Excellent. So, Dr. Kaye, would you have anything to add to that?
I'll just say that all these different diverse disciplines came together twice a day in the Incident Command Center. And it was really sort of something to see and participate in. And Will, who will be very modest, was our link to the command center, which means he was often subject to multiple meetings a day about this. But I mean, that was really when they asked us, how's it going? What's the latest? When are your tests going to be back? How many reprocessing cycles have been done with the fit testing? I mean, and then we would hear from logistics, we'd hear from nursing, we'd hear from the clinical, how many, what's up with our dedicated units, and what's up with nursing, what's up with mass supply. And so it was really something to see. And that's sort of where all the pieces came together and the rubber hit the road, so to speak.
Wow. Yeah. That's amazing collaboration. And, it would have been something to see that, but I'm so glad that you guys not only published it, but then are here also to share that with us, because I think there's a lot of takeaways from this that hopefully others will learn from. Another thing that I didn't realize until there was another publication shared with me, but this work done at U of M was part of a bigger national project called N95 Decon. Can you explain for our listeners how that developed and how that helped your individual work?
Yeah, so again, I'm not an expert, and I didn't personally interact with N95 Decon, but Nancy Love, who was one of from this engineering school, was one of the our major people who not only helped with our studies and led some of the components, but she interfaced with this group. And this was really a group that got together very quickly of scientists in the both academic and the private sector who simply got together in a crisis pandemic situation to share the latest data and the latest findings. And early on, some of our tests that we did with moist heat, we saved some time and avoided some blind alleys through experts sharing their data openly. And there was a lot of preprint publication on, publicly available websites of data. It was just extremely collaborative. And it was, again, one of the silver linings of this COVID-19 pandemic has been, I think, how the scientific community has really become very altruistic in many situations and came together and shared. And this was a group that met, I think, for a period of time every day. And it grew and grew, and people would share from labs all across the country and I think in even other parts of the world eventually about what was going on with N95 reprocessing, what was working, what wasn't working, who was doing what types of studies. So it was initially, I think, started as a fairly loose collaboration, but quickly sort of became N95 Decon and became quite organized, and I think was extremely productive and probably prevented several unnecessary exposures and improved safety for healthcare workers more rapidly than it would have been able to happen if everyone worked in their silo. So academic walls and barriers were certainly torn down, and there was a lot of collegiality.
Wow. Yeah. Some of the positives, I guess, that we can all take away from a very nasty situation. So you're right on about that. So lastly, before I get into a couple sort of extra questions that I thought of, if you don't mind, as the reuse and reprocessing of N95 masks was time limited, what do you believe are the takeaways or next steps for this knowledge and these processes?
I mean, that's a really good question. I think, first of all, the experience of the different disciplines coming together and how quickly we were able to convert, washers in areas of sterilization and disinfection, convert those into actually dryers. And the way with almost like MacGyver-like strategy, we were able to piece together reprocessing where in a pinch we could do it. We didn't have to do it right away, but if we were put in a corner, we felt we had ways that we could do it that would be safe. Maybe not what we ended up doing as the optimal, but it was really impressive. And I feel like if we were put in a similar situation now, at least we wouldn't be starting at stage zero. We would already have some alliances between engineering, clinical medicine, nursing, logistics, and so I think that was huge. I think from our experiment, and we're still waiting, our manuscript has been submitted, hopefully it'll be published in peer review literature very soon. But one of the major lessons that we learned was we need to do the types of experiments where we're not just testing a single virus, but we're testing a variety of diverse viruses. Also, we can't forget about bacteria. I mean, if we end up killing all the viruses, but C. diff and MRSA persist, that might be fine in in an acute pandemic. But ultimately, we don't like to reuse equipment patients with C. diff, but C. diff can kill people too. So we really were very pleased with the group we were able to pull together and the diversity of pathogens, and also not just testing the pathogens, but as Will pointed out, also looking at safety issues like fit. Is fit maintained? Is filtration efficiency maintained? And we were one of the first groups to actually study all of those things in a wide range of pathogens together. And not only that, to study a wide range of reprocessing mechanisms. And, traditionally, as I said, N95s are FDA approved to be single use. So if anything, companies have traditionally been discouraged from trying to fund studies to see whether these could be safely reprocessed. So I'm not knocking other research that's out there. I'm just saying this is clearly pointed out. I think we've helped create somewhat of a blueprint for methodology moving forward for reprocessing of these sort of PPE, the protective equipment that healthcare workers use in pandemic and also in endemic pathogen scenarios. And I also think we showed the importance of having multidisciplinary group together. If we just had our PhD experts, just our engineers, or just our PhD virologists, there would have been wonderful stuff done. But some of the clinical relevance and practicality and scalability issues and healthcare worker safety and occupational health issues wouldn't have been addressed. And certainly Will and I, we can put on our white coat and take care of a patient. Will can do it in an OR. I can think a lot as an ID doctor and make recommendations. But certainly there's no way we could have accomplished the types of high-level science that were done without our aeronautic engineers, our civil engineers, our virologists, and also we couldn't have done this without the logistics people. We couldn't have done this without our experts in sterile processing. And to do it right, I always say medicine is a team sport. It's not just one expert, everything, we're going to fix everything, I don't need any help. And I think in this type of situation, this N95 reprocessing and establishing a safe method to collect and deliver the masks to healthcare workers truly was a team sport. And we could not have done what we did in silos or even in small collaborations. It really took a lot of smart people and a lot of dedicated people who gave a lot of their time and effort to make this happen.
Yeah, and I appreciate what you're saying. And I also feel like that was huge for everybody because there's so many facilities out there that don't have those resources. And now they're going to have all this data and this study material that you're going to hopefully have done in this peer-reviewed literature as well. So now that everyone will have access to that. So kudos to your team. And I just want to also ask Dr. Roberts if he had any takeaways that he'd like to add as well.
Yeah, thank you. I would just amplify Keith's last point. The University of Michigan is a very unique place for its culture and its collaboration. And this was an example of a crisis where all aspects of the University of Michigan were able to rise to the occasion in a collaborative fashion and actually solve a problem and then make that solution available to the wider world. So I think it's an excellent example of how things can be done correctly. And it's a uniqueness to the University of Michigan and perhaps a few other institutions that have that culture in place to pull something off in that short time in those situations.
Excellent. Well, thank you, Dr. Roberts and Dr. Kaye. I do want to sort of hit you up with one impromptu question, although I'm sure you know the answer to it, and you already answered my second one. You had said, Dr. Roberts, earlier about testing all the modalities that were available for processing, whether it was ozone and, vaporized hydrogen peroxide, EO, all of those things. But one of the things I don't want to finish this interview and forget to ask is, which one did you settle on and why?
So in the end, we made two recommendations to the command center. So the process of using UV plus moist heat was a very robust process and worked extremely well. But we also wanted to make sure we had an alternative in the event that supplies ran short or we could no longer do that modality or that process. And so hydrogen peroxide was an alternative that we tested extensively and was equally as good on all accounts. And so we made recommendations to the command center that both were feasible and doable. And in fact, both were set up and operational at one point during this process.
Excellent. So how did you accomplish the moist heat?
Well, it evolved from putting the mask through the dryer, which was a converted washer. But through the research, it became very clear that the amount of moisture, the humidity, was really important for effective pathogen treatment. And so we needed to evolve the technique to have a more humidity-controlled oven in which to place the masks to get the optimal effect.
Excellent. Well, I just want to congratulate you both and your team back at U of M for this great work. And thank you again, Dr. Kaye and Dr. Roberts. I really appreciate you sharing your story with the sterile processing industry. And I hope that this could help other facilities develop their process in response to PPE shortages going forward, whether it's for this COVID-19 pandemic or maybe even down the line for future challenges. So thank you again, both.
Thanks, Kevin.
Thank you very much.
Just to wrap up this episode, I spoke with Dr. Kaye and Dr. Roberts from the University of Michigan, and they shared with us an amazing story of collaboration that took place in their health system that led to safe, effective reuse of PPE during a very challenging time of the pandemic. It is my hope that their work will help others throughout the country or even the world if and when they run into a shortage of life-saving PPE. I hope you all enjoyed this episode as much as I did. Please check out our other episodes on Apple Podcasts. Leave us a rating and review because your feedback is very important to us. Thanks again for listening. All opinions expressed on this show are those of the presenters. Before using any medical device, it is important to review the device manufacturer's instructions for use.